so they cannot get into this program. What measures is the minister or the government doing to ensure that they are attended to like any other person? Second, Honorable Speaker, he has talked about they'll pay for the indigents. When is the government paying for the indigents? So they shouldn't just talk when we will. Diseases cannot wait. When are they paying for the indigents?
Thank you. KJ?
Mr. Speaker, I thank you. And I thank you also for admitting Waziri DUALE to this House in an afternoon where we've been talking about experts, and maybe to also showcase that from the UDA party and the Kenya Kwanza side of the House, we also have experts, Mr. Speaker. This is a gentleman who has done an amazing job in environment. We are waiting to swim in Nairobi River, and as soon as he had set up the plan, he's now in the Ministry of Health, where we hope he's going to clean up Afia House. Mr. Speaker, the job that the Honorable DUALE has done today is a job of advocacy and sensitization. We have also seen him on TV doing the same. Mr. Speaker, our concern is, today as you speak about SHA, the only story that is out there is about the teething problems. The concern is this ministry having any tangible plans to put up proper sensitization and communication campaigns to allay the fears that Kenyans have? Because the questions that Honorable Kawanjiko has are the same questions Kenyans have there. The information sits at the ministry. However, it does not trickle down to the people. So that even as they're investing on the big plans in the ministry, how does this message get down to the people in Kenya? And finally, Mr. Speaker, there is a big investment in terms of money by Kenyans on making this universal health care work. We are still very dependent on remedies, therapies, and medicines that come from outside Kenya. While we very well know, Mr. Speaker, that even from our traditional medicine, from our culture, we've got therapies that are better than even medicine that we import through KEMSA. Is there a component of the monies that we're investing in this plan going into research and development so that we can be able to develop our own naturally grown remedies and therapies for our country, so that we do not export all the monies that we are raising through this very beautiful program to international pharmaceutical companies? I thank you very much, Mr. Speaker.
Professor Jaldesa. Kawanjiko, I know I should have given you the first bite. I'll come to you.
Thank
Professor,
you, Mr. Thank you, Mr.
Joy
Speaker.
Riders, ask one question each.
I just want to inform the minister that so long as the county governments are on strike, Kenyatta National Hospital and other referral hospitals will be overcrowded with patients who are not supposed to be there. But my question is, when we thought of this SHA, the main thing that we were assured of was that patients' medical bill will not be a bother anymore. It will not be a burden to the society. It will not be a burden to the members of parliament. Unfortunately, most of the disease that people have that gives you very high bill is the critical, chronic, and emergency infectious, which is under CCIF fund. Now, many of our patients have huge bills turning into millions of money, yet SHA can only pay a maximum of 300,000. What steps are you going to make sure that these patients or the relatives who have lost their relatives in the hospital, or somebody has been discharged, cannot be detained waiting for that money to be paid? Because that is the major problem. We are not talking about level 1, level 2, level 3 health facilities. The major problem people have in this country is public health facilities, level 5, level 6, and they accrue a huge bill. And because they are indigents, as Mheshimiwa Wanjiku said, and yet the relatives, when they want to bury their dead, they cannot be allowed to carry the body until they have paid. And yet, these people are paid up SHA members. Thank you, Mr. Speaker.
Give her the mic.
Thank you, Honorable Speaker, for the opportunity to ask my question. And my question, Honorable Speaker, is in regard to the monthly subscription that members to SHA have to pay. Honorable Speaker, when I go around my county, the greatest question I get in regards to SHA is members who are unemployed, the elderly, and those who are self-employed also, asking why we cannot give a flat rate on SHA, where they pay a flat rate of a monthly subscription. Honorable Speaker, I would want to give a very short example in my county, where we have people who rent houses, maybe in the slums, and the floor is concrete, the walls are concrete. When they go for the means testing, they will be charged that they are actually wealthy, yet maybe they are not wealthy as they are assumed. Then we have another group that live in a mud house, thatched, but with 1,000 head of cattle, for example. This person will be assumed by virtue that they are living in a mud house, they are supposed to be paying less. Honorable Speaker, my question would be, why don't we have a flat rate for the unemployed, the self-employed, and the elderly? Thank you. And the indigents? Thank you.
Thank you. Bissau.
Thank you, Mr. Speaker, sir. For me, to the CS, we have situations whereby SHA is not working, especially in counties. Trans Nzoia County, where I come from, as we speak today, we've just buried a Miss Alwoj, 21-year-old girl, who yesterday when she was being moved from the morgue, there was a lot of riots. And it's because if you took even the staff from the county, their monies have been deducted, but they have not been remitted to the ministry. So what are you going to do to ensure that such counties, the funds are actually remitted? Number two, there is a collapsed health system. If you look at our Article 187, where one function fails in a government, if it's like county government, it can be moved to the national government. So Trans Nzoia, it has completely collapsed. What are you going to do to help us rejuvenate the health system within Trans Nzoia? And lastly, Duncan Lumumba, a kidney patient, only his dialysis is covered. He's moved from Trans Nzoia, is now living in Eldoret, and we have to contribute for his medicine. Why isn't SHA covering such patients with such an ailment? Thank you.
Thank you. Pauline.
Thank you, Mr. Speaker, for giving me this chance. I have two questions to the Minister. First, I want to thank him for the elaborate information that he has given Kenyans on SHA. My question, Mr. Speaker, to the Minister, question number one is, what measures is the Ministry putting in place to ensure that places that have low registration on SHA are really encouraged and given information so that many community members can register? I can give an example of Samburu County, because if I look at the data of the people who have registered, I think Samburu County is on the bottom. So what measures are you putting in place to ensure that those people uptake SHA and also they get to benefit out of it? Number two, we know that majority of our patients or communities get treated at level 2 and level 3. And Mr. Speaker, we know the situation of facilities at the county levels. The healthcare system at the county levels is really collapsing. You go to any facility, you don't find medicine. The health workers are on strike. So communities at the end of it are not accessing services. What can we do to ensure that at the level 2 and 3, where majority of the community members go for services, really can be empowered to have staff in place, to have infrastructure, and also to have medicine? Thank you, Mr. Speaker.
Thank you. Makali.
With the mic. Thank you, Honorable Speaker. One of the issues that has been identified by the Minister as a challenge is manipulation of data by the beneficiary, the likely beneficiaries. Is the ministry making use of the community health workers on the ground to ensure that we develop a proper system for identifying the beneficiaries? And two, one of the issues which are also facing are the former NHIF employees. The minister has said we are going to do, those ones who have certificates will be deployed, proper certificates. Has the ministry carried out a staff audit of the former defunct NHIF defunct employees to see whom they are going to absorb from those particular NHIF defunct employees? Thank you, Madam Speaker.
Martin.
Thank you, Mr. Speaker, and I want to thank the CS for the energy has come to the docket. And it is true, Mr. Speaker, if the level 2, 3, and 4 can work, then we can have early disease detection and deal with these diseases and prevent more expenditures. But the reality is, CS, it anchors on two things. One is the human resource for health. And you know very well that the United States government have taken out so many health workers who are in their payroll. That's a fact. A dispensary may have now one nurse. If goes on training, there's nobody. The other factor is the fielding rate for KEMSA. So we have HR and we have medicine. If those two are missing, then the flare-up you are talking about to level 5 and 6 is true. So what measures are you taking as a ministry to ensure that the HR are there and also the field rate for KEMSA is as needed? Thank you, Mr. Speaker.
Mumbi. Wamumbi.
Thank you, Mr. Speaker. Mr. Speaker, last week we had a debate when we were asking whether an unteacher person can go with students to drama festivals. And when we asked that, they asked, is Honorable DUALE a doctor? I want to confirm today from the presentation and the way Waziri DUALE has handled the questions that indeed he is a doctor. My question, yes.
We know he isn't. Just say he's like a doctor.
He is like a doctor, yes. Mr. Speaker. Mr. Speaker, my question to Waziri DUALE is on ICU patients. We have had a challenge with ICU patients. For example, the PS Public Health knows that I had an issue at Tomotomo Hospital in Madera constituency where an ICU patient passed on with a bill of 1.5 million. And there was a challenge from SHA in settling that bill. So, Waziri, how far are we with regard to ICU patients? Thank you.
Mama Nairobi.
Thank you, Mr. Speaker. To the CS, through the Speaker, I want to talk about what Honorable Awanda was talking about. It's children. We know that in Kenya we have a lot of defiled children and a lot of children who engage in sex before they reach the age of 18.